Hi guys, welcome back to the channel. I'm Dr. Downey, and today we're going to be speaking about the best weight loss drug in men. So this video is going to be more opinionated because when you say the best of anything, it's difficult to prove whether or not it truly is the best, as there's always conflicting research. But in this video, I just wanted to draw attention to a particular drug that I think could be very beneficial for men in particular in the future. And the reason I specifically mention men is because this drug, as you'll see in this video, has more effects on a man than just improving weight loss. Some of you may already know the drug I'm going to mention, and it has been quite popular recently all over social media, so it shouldn't be a mystery to most of you. So the drug I'm going to be speaking about is Liraglutide. And you may ask me why I'm not speaking about semaglutide or Ozempic, which has more media attention, and that's mostly due to the research in semaglutide, mostly having female participants, and also it doesn't look at the outcomes that I wanted to look at, in particular positive outcomes for men, which include testosterone levels, fertility, as well as just overall general well-being in men. Semaglutide has a lot of strong research behind it because a lot of its trials use many patients in the data, and it has been proven to show a significant amount of weight loss. In a randomized control trial, it showed that semaglutide at a dose of 2.4 milligrams, I think, resulted in an 18% body weight reduction. So both of these drugs fall under the class of GLP-1 agonists, or receptor agonists, and essentially they agonize the GLP-1 receptor. So GLP means glucagon-like peptide 1, and essentially this is a incretin hormone produced in the end of the bowel, I think, by these enteroendocrine L cells. Its release is done in response to food intake. So if you eat, GLP-1 is released. So what it does is it stimulates insulin secretion as well as decreases glucagon secretion. But not only this, it delays gastric emptying, and this kind of leads to its anorexic effects. So essentially it decreases your appetite. Through this anorexic effect, it leads to weight reduction. The GLP-1 agonists have not only gained attention because of their weight loss abilities, but because they have protective cardiovascular benefits, as well as a fairly low risk of hypoglycemia. But in a lot of smaller trials, when they give a super physiological amount of GLP-1, it tends to exert these pleiotropic effects. So essentially what this is it has effects beyond that of just glucose homeostasis or sugar control. It seems to also stimulate the HPTA, and we'll get into this a bit more later on. So now I'm going to give you the research behind why I think liraglutide could be one of the best weight loss drugs for men. And this is specifically because a lot of the trials with liraglutide look at the outcomes that interest us when looking at weight reduction in men. Furthermore, semaglutide doesn't seem to have this research, but that doesn't mean semaglutide doesn't have these effects, since they're both in a similar class. But I'm just going to specifically mention liraglutide due to the availability of the research. And the first study we're going to look at is called Sexual and Reproductive Outcomes in Obese Fertile Men with Functional Hypogonadism After Treatment with Liraglutide. These are preliminary results, and the sample sizes in these groups are quite small, but it's just food for thought, and these results have kind of been demonstrated in larger trials. But this trial in particular focused on these two outcomes, which are important to men. So I'll get on to the limitations at the end of this study. But essentially in the study they looked at men with obesity and functional hypogonadism, or metabolic hypogonadism. It's kind of a new term where when you become obese, you have a higher chance of HPTA suppression due to the I think it's the adipokines that fat releases, and this itself reduces your testosterone levels and fertility. So there you can already see a limitation. If we reduce weight in obese men, obviously we're going to increase their fertility potential and testosterone levels. So essentially, 3 groups. Group A got HCG 2000 IUs twice a week. Group B was the liraglutide group. They were given a dose of 1.2 that was titrated up to 3 milligrams. So the study was done for 4 months. And in the last group, the individuals there were given testosterone gel at 60 milligrams every day. So essentially, in the study, they looked at a variety of outcomes, in particular testosterone and fertility. But I'll show the results up on the screen now, and what we can see here is the significant weight loss that Group B had, and that was the liraglutide group. In fact, they lost 10.3% of their body weight, and their BMI reduced by 16.7%, with a waist circumference reduction of 8.3%. All of these were statistically significant, and as you can see in both of the other groups, weight reduction never reached significant levels. Now again, there's an issue here with the fact that in Group B, which was the liraglutide group, they did start off with a higher body weight and BMI, but it still shows how efficacious it is in comparison to testosterone and HCG. Something I forgot to mention is that all of the participants were put on a calorie-restricted diet of 1,200 to 1,800 calories a day. So this reduction in body weight doesn't really show us anything new when it comes to GLP-1 agonists. But when we get into the more interesting results, we'll see why I picked liraglutide. And this has to do with the total testosterone, or serum testosterone, which increased by 192% in the liraglutide group as compared to the other 2 groups, which didn't have a significant increase in testosterone levels. Group C, that was actually receiving testosterone, did have an increase that didn't reach statistical significance, and the HCG group also had an increase that didn't reach statistical significance. So it's quite interesting to see what a massive increase in testosterone GLP-1 did to these participants. But again, you could argue that this was because of the drastic weight reduction, which I'm not arguing against just yet. Furthermore, it's interesting to note that liraglutide here increased testosterone levels more than the testosterone gel. So whilst these results are interesting, and I do think liraglutide does have stimulatory effects on testosterone production, I think this result might have been an error in the research method or something, because other studies that looked at this didn't report a result as drastic. But this essentially put these hypogonadal men out into mid-range levels. If we look here, they went from around 150 nanograms per deciliter up to almost, 400 nanograms per deciliter. But what I think is most interesting are the changes in LH and FSH. And the reason I find this most interesting is because both of these results have a lot of research to support them. And that's that GLP-1 receptor agonists seem to stimulate LH and FSH. In studies in mice, they found that intracerebral injection of GLP-1 receptor agonists seemed to spike LH levels and FSH levels. This could perhaps mean that they do influence the HPTA, as we mentioned before, and this means it has beneficial effects not only on testosterone, but perhaps fertility. So getting on to fertility, what we find here is that in Group B participants, the liraglutide group, there was an increase in sperm motility, which resulted highly significant levels of 142% increase in sperm motility. So when comparing it to the HCG group, which is commonly used especially by bodybuilders, but also in reproductive practices to increase fertility, Group A had an increase in 58.3%, which shows that liraglutide had a more significant effect. What was also very interesting is the increase in IIEF5 score, which is essentially looking at erectile function and things like that. These results are quite drastic, and it shows that In group B, they had a drastic increase in the score, meaning erectile function was actually quite similar to using a PDE5 inhibitor, which is essentially like Cialis or Viagra. And this is when you start becoming skeptical. So this news is good, and we'll see in another study that it does actually have these effects, but perhaps they're not as pronounced as in this study. It was shown that SHBG increased quite significantly. So some have differing opinions, and I will make a video on SHBG in the future. But high levels of SHBG actually can be quite protective against cardiovascular disease as well as non-alcoholic fatty liver disease. But I'll go into more depth in a separate video. I think I mentioned the limitations during my presentation of these results. But again, just to mention, there was no placebo group. Weight reduction itself does increase testosterone production. Apologies for the change in clothes, the memory card failed. So just to conclude our discussion on the first study, what we've noticed is that the results in fertility and testosterone kind of extend that of just simple weight loss. And that's because there are certain mechanisms behind GLP-1 receptor agonists that kind of have these pleiotropic effects on fertility, as I mentioned at the beginning of this video. And I think it's important to note, there have been small-scale in vitro studies that have shown the GLP-1 receptor agonists can influence Leydig cells. And for those who don't know, Leydig cells are quite important in testosterone production. Furthermore, the improvement in erectile function can also be attributed to the fact that GLP-1 receptor agonists seem to have a positive effect on the endothelial lining of the vessels in the penis. And it kind of reverses the changes that we see when you age. As we age, the endothelial cells become less receptive to nitric oxide and things like that that help promote erectile function. And we see that GLP-1 receptor agonists kind of have a positive effect on these endothelial cells and make them more receptive to factors that are important in erectile function. Furthermore, this can be extended beyond that of just the penis. It would be throughout the body with coronary artery dilatation, as well as brachial artery dilatation, which all kind of assist in improving cardiovascular function as well as improving your blood pressure. There was another trial done with liraglutide in functional hypogonadal men. Essentially, as we mentioned before, obesity causes functional hypogonadism. And in this trial, they were given a calorie-restricted diet, and then liraglutide was used initially at 0.6 milligrams daily, and then titrated up to 3 milligrams daily. And this was injected subcutaneously. Furthermore, they compared this to testosterone patch, I think, or gel, just to compare the two. Unfortunately, again, there's no placebo in this trial. And when we pull up the results from this trial, we can see results that seem a bit more realistic than the previous trial. And this would show that in the TRT group, or those receiving testosterone, there was an obvious increase in total testosterone. However, there was also a significant increase in testosterone in the liraglutide group. However, it wasn't as drastic as it was in the previous study, and it just reached statistical significance. What is more important, though, I think, is the impact that we can see liraglutide had on FSH and LH. These two pituitary hormones, they're important not only in testosterone functioning optimally, but also fertility. And we can see that obviously in the TRT group, LH and FSH decrease quite significantly, which would indicate a degree of suppression. However, we can see that in the liraglutide group that FSH and LH increased quite significantly. And this is quite important because luteinizing hormone has been linked to intratesticular testosterone production. And this is essentially important because intratesticular testosterone function is a marker of how well your testicles are functioning, i.e. by producing adequate testosterone, and intratesticular testosterone production is important for fertility. Furthermore, FSH is there to help obviously stimulate those follicles or developing sperm cells, which again aids in this improvement in fertility. Now we look at the weight loss aspect, which is obviously quite an important part that a lot of people look to these drugs for. And we can see that the average weight reduction was 8 kilograms. When you compare that to TRT, we know that TRT doesn't really cause much weight reduction. This was shown in meta-analyses. In this trial, they did show a weight reduction. However, it was small in comparison to the liraglutide group. And overall, we can see that BMI decreased, which is also a good marker, and weight circumference. And weight circumference is quite a good thing to look at, as it's now part of the classification for metabolic syndrome. So if we look at the increase in testosterone, a lot of arguments would state that liraglutide is just increasing testosterone because of the weight reduction. And as I mentioned, that's not fully it. And in this study, I want to expand into that details a bit further. And that's because we actually have data that shows how much your testosterone is expected to increase per percentage body weight loss. So essentially, if you lose 30% of your original body weight, you can expect your total testosterone to increase by 8.7 nanomoles per liter. And on average, if you lose 5% of your body weight, you're expected to have around a 2 nanomole per liter increase in testosterone. And with 10%, it's 2.9. So in this study, these participants, whilst they lost 6% of their original body weight, they had an increase more similar to that of a 10% reduction, which does show that whilst a lot can be attributed to weight loss, there are mechanisms that we are unaware of at this point in time. However, we can make hypotheses, but essentially it indicates that liraglutide has pleiotropic effects when used at supraphysiological dosages. And this could extend to other GLP-1 receptor agonists. However, we don't have those studies done in men as of yet. It's also important to note that in the TRT group, just as a matter of interest, that their insulin resistance actually improved. And this is mostly attributed to the fact that testosterone itself seems to stimulate stem cells into more of the myogenic lineage, so essentially more muscle cell lineage of cells, as opposed to adipocytes or just fat cells. And this can also improve insulin sensitivity. But again, some of these participants were in fact type 2 diabetics. So I think it was 11 out of the 30, so again, small sample size. That would also influence the significance of the change in HbA1c and insulin resistance. Now, lastly, in terms of giving evidence to support liraglutide's use in men, we have a study that was done on GLP-1 receptor agonists in healthy men, and they looked at the changes in growth hormone levels. In this study, they focused on exenatide, which is another GLP-1 receptor agonist that has an incredibly short half-life, and they looked at liraglutide. And in this study, they actually used quite a conservative dose of liraglutide at just 0.6 daily. And if you remember, that's the dose that they tend to start out these participants on. And what they looked at is they wanted to look at acute changes in growth hormone as well as chronic changes in growth hormone and IGF-1. The rationale behind the study is that we know that when GLP-1 receptor agonists are used, they have these pleiotropic effects, and they've noted that it has these effects on gonadotropin, so they wanted to look at things like growth hormone as well as prolactin. I wanted to focus more on the liraglutide group, as that's the focus of this conversation. However, it was noted that in the exenatide group, there was an acute increase in growth hormone after injection. However, this wasn't noted in the liraglutide group. Of interest, they noted a significant increase in growth hormone after chronic administration, so not acutely. I'll display the results on the screen. But as we can see, there was an actual slight decrease in growth hormone after acute administration, but over time there was a significant increase in growth hormone levels. But IGF-1 levels seem to decrease. However, GLP-1 agonists do interfere insulin-like growth peptide or IGF-1 binding proteins, and this can explain that decrease. But again, looking at IGF-1 in the serum or in your blood is never a really accurate measure of what growth hormone is doing to your whole body. It essentially measures what growth hormone is doing to the liver, since when GH attaches to its receptors on the liver, it releases IGF-1. That test kind of just looks at IGF-1 levels secreted by the liver. So it seems that liraglutide can increase your growth hormone levels. Of interest, they noted in the study that prolactin levels seem to decrease also with the use of GLP-1 receptor agonists. And obviously they noted that there was an increase in LH and testosterone. So again, this just shows that liraglutide has multiple effects that extend beyond just glucose control. But that part kind of just looked at positive things from liraglutide. Let's look at the side effects one can expect. I'll put up a list of all the adverse effects you can expect with liraglutide, and if you look at the p-values from there, you can kind of see which of these side effects is significant and which is not significant. So essentially they just looked at liraglutide compared to an injectable placebo. And as we can see, there was more ejection site reaction in the liraglutide group, and this could be due to solvents they used in the solution. However, a positive thing is that it resulted in lower hypoglycemia. The most common side effects would be nausea, vomiting, and diarrhea. As we can see there, the p-values do indicate it was significant. And this is important to note because whilst that may not concern you, these side effects actually don't tend to wane over time. They only respond to dose adjustment, i.e. lowering the dose. And these can be quite debilitating when using the drug long term. However, these effects are also a result of the anorexic effects of GLP-1 receptor agonists. Looking at other issues they looked at, they found that gallstone disease was actually more common in the liraglutide group. However, rates of cancer did not reach statistical significance. So, as I mentioned at the beginning, I chose liraglutide because there are more studies in males that looked at important outcomes for males, such as fertility, testosterone levels, and improved GH levels also helps with the whole male psyche, since we want to be optimal in all those areas of anabolism as well as fertility. As we know, the reduction in body weight was demonstrated in all trials, and whilst the reduction in body weight would help increase these parameters, the results show that liraglutide itself has effects beyond that of simply just lowering the body weight and thus increasing testosterone. It seems to increase pituitary hormone secretion, which again helps with fertility. I'm not saying semaglutide can't do this, however there aren't many studies that look at these effects in males, and that's simply why I brought up the topic around liraglutide being probably one of the best weight loss drugs in men, because not only does it create that weight loss, but it creates all those other effects that are important to males. However, we mentioned that it does have side effects that actually can be quite severe to certain individuals, mostly around abdominal discomfort, nausea, and vomiting. In terms of the studies so far, it shows that the use of liraglutide within the recommended dosages does seem to be safe, doesn't have serious adverse side effects, but that's not to say that side effects won't come out, and I'm not recommending it to anyone. It would have to be a decision you and your treating doctor would make to weigh up the benefits versus the risks. For those who are more experimental with their body, which I don't recommend, it's an interesting hypothesis, and that's the fact that liraglutide decreases prolactin whilst increasing growth hormone, and if you were to pair that with GH or a secretagogue, which are known to increase prolactin levels, it could balance it out and perhaps have this added on effect of more GH secretion. However, studies still need to be done. Anyway, let me know what you think about liraglutide, whether you think more studies are going to come out saying how unsafe it is, or if you think it could possibly be the new drug of the future. Anyway, thank you for watching this video, and I'll see